So, today we're going to talk about the opportunities with Marma and why you may be interested in signing up for our upcoming Marma Therapy program. There's lots you can do, whether you are a healthcare professional, massage therapist, yoga practitioner, or just someone that wants to support either yourself or your family by using Marma.
Hello everybody. I hope my sound is coming well. So this is the second webinar which we are recording related to the Ayurvedic Marma course which we will be offering. Okay. So if at all you want, you can ask for the other information related to the course and we will be sharing it with you. So like detail of the modules, what is going to be covered, what is the syllabus, etc. Today in today's webinar, I'm going to talk about only what are the opportunities after learning the Marma therapy. Okay, so let's see what is there for us today. So I have always said this that though I have titled it as aim of any healer, but like Ayurveda says, or the science of Ayurveda says that aim of any individual should be focusing on our health, right? Because health is always uh, health comes as a primary priority of all of us, right? So we need to focus on health so that we can take care of the other aspects of our life, right? So as an individual or as a healer, what is our aim? So our aim is to establish the health. Okay, if we are looking as if we are considering as an individual, okay, for us also the primary priority is maintaining health, uplifting the level of the health. And if you are looking towards it as a practitioner, then every practitioner is looking for establishing health in our patient's life, in our clinics, in our client's life, right? So the ultimate goal of individual has to be or is considered as health, establishing health, right? So now when our goal is health, okay, so this health can or Marma therapy can be a helpful tool in both of these aspects, right? So if you're looking towards it as an individualistic purpose for your own self-care, then this can be accommodated in your self-care practices. If you are a clinical therapist, if you are a clinical practitioner, if you are any kind of healthcare worker, then Marma therapy either can be included, incorporated, or you can solely consider Marma therapy as a point of or as a treatment modality into your practice, right? So Marma therapy is very inclusive in nature. So it actually can be practiced with so many other healthcare modalities, not only Ayurveda. In the last webinar, I have said this, that Marma therapy can become a part of your treatment regime if you are an Ayurveda practitioner, if you are even as a kinesiologist, physiotherapist, yoga therapy, energy therapy, right? There are so many other health, even Western medicine, right? Even Western medicine, I have so many students for this course who actually are Western medicine physicians, right? So, but they're using these points for different practices, which can enhance, which can increase the efficacy of the other treatments as well, right? So it's a very inclusive therapy, right? So learning this can help you in taking care of yourself and as an individual, or it can help you to enhance and increase the scope of your practice if you are into healthcare, right? So now um, let's learn let's learn what is the uniqueness of Ayurvedic Varma therapy, right? So it's very important to know that why it is unique, right? Why we should all learn Ayurveda, right? Ayurvedic Varma therapy, right? So there are many uniqueness related to the Varma therapy, right? So I have always said this, if you learn Varma therapy, people believe that you need to open a center and then you need to have so many resources for starting Varma practice. It's not true, right? Marma therapy is extremely simple. It needs nothing except knowledge, right? It's not a single tool is needed if you want to start practicing the Marma therapy for self-care or as a clinician, right? So actually you need nothing, honestly, just a knowledge about these points, okay, where they are located and in which situation, what kind of a therapy can help you with which kind of scenarios, right? So first, you can work from home if you don't want to actually touch anybody, right? Because nowadays so many concerns are getting raised that whether body therapies will exist on this earth or not. So of course they are going to exist, but if at all you are scared of touching anybody or bringing them into your clinic, or if there are other concerns, like many women practitioners have limited hours of working, so they would like to share or they would like to save their working hours in reaching to different clinics, right? Or if people are taking care of their family along with practice, then also Marma therapy is a very good technique to be include which we should include into your practice, right? So you can work from home, okay? Then there is no need of any instrument, right? So not, like I said, you don't need anything, right? There is no need of instrument including a massage table, right? You even don't need a massage table for practicing Marma, right? For recommending Marma therapy, for doing it on somebody on a chair. If even chair is not there, you can practice Marma therapy when the person is standing, right? So actually there is no investment needed for practicing Marma. Okay. So second, you can work with very minimal resources. So there is no assistant needed. Okay. There is no temperature requirement needed. So it's very easy to practice therapy, right? So you can, if you want, you can work in person as well. If you want, you can work online as well. You can do mix up sessions as well, that some sessions online, some sessions in your clinic or in your practice space as well. Like I said this before, so Marma therapy is having scope in so many other healthcare practices like physiotherapist, kinesiologist, acupressurist, acupuncture, yoga, right? Ayurveda, so of course, it is a therapy which is explained in Ayurveda, but not only Ayurveda, but if you are a practitioner of any other specialty, it has huge scope in cosmetology, right? So those which are working in beauty care treatments, right, for better status of skin, hair, nail and feet, right? There is a huge scope of Marma therapy in this sector as well, right? So there are many other, like orthopedic, okay, section of the practice, pain management. Okay, so there are some students of mine who have established their pain clinics in different cities of different countries, right, where they treat only pain, and Marma therapy has helped them in getting much better results, right? Because Marma therapies give quick result. Okay, it doesn't involve using any single herb, right? So herb or any other kind of medicine, right, or any other kind of local application or internal consumption of any kind of medicines, right? So that's why it can be absolutely medicine-less practice of any pathy, not only Western medicine, but even Ayurveda medicine, homeopathy medicine, etc. You don't need actually anything for practicing Marma therapy. So it has huge scope in getting established as its own, or its, because of its capability, it can be established as its as a separate practice. Plus, it can be integrated with other healthcare practices as well. So you can open clinics like cosmetology clinic or pain management clinic, okay, or even rejuvenation clinics with the help of making making Marma as a part of your treatment, or itself Marma as a main therapy treatment, right? Then next, you can integrate with other, like I said, it can be integrated with other healthcare practices. So that gives us an opportunity to get integrated with other healthcare practitioners as well. So you can approach them and you can include your treatment as Marma therapy into their practices. Okay. Then it can work or with or without herbal medicines, right? So of course, herbal medicines is a huge part of Ayurveda, right? Diet, lifestyle, herbs, detox treatments, and self-care practices. These are all parts of Ayurvedic therapies, right? So if at all you want, if you at all you have knowledge of these all types of treatments, okay, then it can be incorporated with Marma therapy as well, right? Like I said, any other healthcare facility can be integrated with it. Ayurvedic treatments, which includes herbal methods, detox treatments, it includes lifestyle changes, it includes diet recommendations. Along with that, Marma therapy also can become a part of it, right? So which can give much better efficacy of treatments, okay? Then you can become a teacher, right, or an educator. So you can teach to your patients, you can teach to other people who would like to take care of themselves or who would like to teach to others. Why? Because Marma therapy can be practiced completely as a private treatment therapy, right? So Marma points are very logical. There are simple charts which I will be providing. So these charts can be handed over to your clients. So for initial few setups or for initial few therapies, you can help them how to do this treatment, and it is so simple that if they do it regularly, they can get much better results, right? So it can actually be taught to patients as well, to people as well, for the different objectives, right, for which they are coming to you, or for which they are for which you are helping them, or as an individual, whatever problems they're struggling with, you can focus your Marma therapy on that, and then you can educate to your clients or your practitioners. So in the last class, I have mentioned that I will be providing simple charts which will include the Marma points in specific conditions. Like what? So if I have shoulder pain, okay, if I'm getting a client with shoulder pain, then what are the names of the Marma points which you should be recommending to them? So that will give you a very simple idea. So I have made sure that the course which I have designed, okay, is very practical oriented course, right, which you can start utilizing right from the first day, and even after finishing the course you will not stuck anywhere, right? So you can refer to the notes and follow whatever is written in the notes in a very simple way. I myself using Marma therapy for so many years. This course I have taught in more than 20 countries, and students have always found out it extremely helpful and fascinating when they see results in a very short period of time for their clients, right? So we are accepting new admissions. We already have got some admissions. There is space left for some practitioners. So if any one of you would like to join the course, you can talk to Carly and she will help you with the registration process. Carly, would you like to add any of your personal experience?
I do find I share the points more, like you were mentioning at the bottom, and educate people how to do this on their own. And I find it to be a wonderful tool that's empowering for clients when I talk to them, because I work with a lot of people from a distance. It is a really nice way to connect and show them something that they can do hands-on for themselves. And as she was mentioning, very swiftly they feel results. And so it's really nice when we touch back with them after a week or 2 weeks and have the conversation, and they've been practicing and they feel a lot better. So that's how we use it. I also, as a yoga practitioner, find it really interesting to understand when certain points are in contact either with the body or with the floor, what's happening through the flow of energy to those vital centers. And that's something that we can talk about during the program also. So there is, as she mentioned, a lot of offerings that you can share with Marma, either at home or professionally. And if you take the course, we'll definitely help you explore that as you finish up, because it's something that we don't want to hold for ourselves, but we should be out there sharing with the world. So if you are interested, feel free to reach out to me directly and we can get you registered for our upcoming program. And we hope to see you there.
Absolutely, right? So please feel free. I am going to make this presentation very simple. Okay, there is one more presentation which we will be recording in future. Okay, so you can listen to these recordings and understand what what you will be getting after signing up. Okay, this is all for today, and then we will meet with all of you again in another webinar. Bye for now.
Thank you. Peace.